Good day. I'm Dr. Charles Denham. I'm chairman of TMIT Global and one of the co-founders of the MedTech Bystander Rescue Care Program. I'll be both a speaker and your moderator today. We're so very blessed you're joining us to learn how to keep your family safe. So it's my pleasure to introduce Jennifer Dingman, who has been a longstanding leader in patient safety, served on national committees, national boards, is a published author. Most importantly, she's been our voice of the patient throughout this coronavirus crisis. She is the 2018 winner of the Pete Conrad Global Patient Safety Award for great work in national programs that have saved many, many lives and many millions of dollars. Jennifer, would you please set our course heading for today?
Thank you, Dr. Denham. It's great to be here. I'm really looking forward to today's program about how stressed out our emergency safety net is. This is really, really important for all of our participants. I urge you to please share the future video with your colleagues, friends, and families. And again, thank you all for being here, and I'll hand it back over to you, Dr. Denham.
Thank you, Jenny, and thank you for all you do. So today, what we'll be covering is we'll be covering our what we call our safety net. These are the questions that we want to answer. So what is the state of our public safety net, and why is it important for your family? How do you now deal with family medical emergencies, given that this safety net has huge gaps in it, which you'll hear a little bit more about? What do I need to know about EMS? How do we help loved ones get to the emergency department now that we're coming through the coronavirus crisis, and hopefully will not be in a crisis state, but now we've got a very frayed safety net with many gaps? How has COVID impacted law enforcement, in addition to the divisive things that have been going on that have really put enormous challenges against the leaders of our law enforcement community? How has COVID impacted our firefighters? And then finally, what can Good Samaritans do now in this COVID world, and what do we need to be aware of that's critically important? As we developed the documentary that I introduced briefly, First Responders, Best Responders Out of the Danger Zone, we're applying a lot of the principles that we have learned are extremely valuable to leading high performance, and you'll hear from Dr. Boats, high reliability organizations. And the high performance envelope is really at the intersection of three spheres: great leadership, and Ann Rhodes, the co-founder of JetBlue and the former leader of the people systems for Southwest Airlines, and on many boards of many of the brands that you would know, say leaders drive values, values drive behaviors, behaviors drive performance, and the collective behaviors of your organization are its culture. So leaders really are absolutely critical, and good leadership skills are fundamental. At that intersection, though, of the high performance envelope are the best and better practices. What are the evidence-based practices in law enforcement, firefighting, emergency care, and even family care? And then finally, what are the technologies that can enable those best or better practices that are led by our great leaders of these organizations? So we'll constantly be coming back to that. I'm really delighted to have not only Jenny Dingman, but we have Dr. Greg Boats, whose dual faculty appointments are at the University of Texas MD Anderson Cancer Center and Stanford Medical School. Chief Bill Adcox, who's not only the Chief Security Officer, but also an Associate Vice President at the University of Texas MD Anderson Cancer Center. Dr. Christopher Peabody, who is pre-recorded today. They are in such incredible straits right now with the lack of staff to deliver emergency care that he couldn't be on live, but we recorded his discussion today. Charlie Denham will reference the checklist that Dr. Boats had really inspired, that we now use with families to help them keep safe throughout the COVID crisis. Dr. Brittany Bartow Owens is a pediatrician, community pediatrician, that's really given us some great insights on how to take care of our young ones. Vicki King is the assistant police chief at the University of Texas, MD Anderson Cancer Center, and along with Chief Adcox is one of our real leaders in threat safety science. And we have David Morris, who's a forensic psychologist, as well as a JD, who has great passion for what we can do in this public safety net in law enforcement, firefighters, EMS, and the emergency department. And we'll briefly mention David Besch, who's an award-winning educator who worked together with Charlie Denham and Dr. Boats to develop the Family Lifeguard program. So our purpose is to enrich the lives of families, patients, and caregivers. Our mission at TMIT and the MedTech Bystander Rescue Care Program is to help save lives, save money, and create value in the communities we serve. Our core values and what we've been taught by Ann Rhodes are they're very critical. What's your DNA of your organization are its core values. And we try to live and breathe integrity, compassion, accountability, reliability, and entrepreneurship, social entrepreneurship. And we try to live those values. None of our speakers have anything to disclose. No money has been received from pharmaceutical or device companies in the healthcare industry, and we won't be discussing any products or influence there. You can go back to our website to watch more of the content that will continually update at www.medtechglobal.org. And you can watch videos. Every month we update the progress report of the work that we've been doing in many areas that we'll discuss right now, and I won't cover those, however, through this community of practice. So feel free to go and watch that videotape. You know, we've really been through a tough time. The variant evolution has really thrown us a lot of curveballs. I like to think about what Michael Osterholm, who is at the University of Minnesota, one of our leading epidemiologists who's been right on all the way through the process, is we have to be humble. And although we hope that we won't have any more surges, we really need to recognize that we can have a lot of curveballs from the virus, and it's by no means over. However, today we're going to be talking about our stressed safety net, public safety net, as a result of that. So you can go to our website, and on the left side, you see of this slide, we post all of our 90-minute programs, and you can go ahead and watch those, but there's an individual page where we've broken up these talks that we've been given so that people can not eat the whole meal, but actually have a bite here and there. And we try to update those continuously because the science is just changing constantly. So about 3 years ago, before the COVID crisis hit, Chief Adcox and I, and with the support of Vicki King and with Dr. Boats and leaders from multiple organizations, including Mayo Clinic, and you see on the lower left-hand corner, Thomas Seltner, the former health minister of Switzerland, we focused on what we call emerging threats in this threat safety science area. What should be keeping us up at night, or what are keeping us up at night? Interestingly, many of these organizations have joined us to kind of focus on many of the areas, some of them visible, some of them invisible to us. Many of us keep being kept up at night focusing on those. Interestingly, readiness for epidemics was one of them that we recognize, with more than 200 being tracked a year by WHO. We know that this is a critical issue. However, there are other topics, and we cover these in the series of webinars that we undertake, and we'll keep reminding ourselves throughout this program that we're talking to you who are families and family leaders of essential critical workers of our major medical centers and the 17 industry sectors that Homeland Security has defined as essential infrastructure. But just as an FYI, we also address healthcare employee fraud, patient fraud, and a number of areas. So TMIT is composed of more than 3,100 hospitals and 3,000 communities. How this evolved was we started this nonprofit 37 years ago, and it grew through our work with the Leapfrog Group, the National Quality Forum, CMS, a number of the federal agencies in helping, and CMS is the Centers for Medicare and Medicaid, who pay the bills for Medicare for those of you who have family members that are older than 65. And over the years, these hospitals participated in many of our communities of practice to get better. What happened was that we've collected the most wonderful group of dedicated experts in clinical, operational, financial, law enforcement, biomedical engineering, many areas of healthcare, and many nonprofits and many technology leaders. We have over 500 subject matter experts that serve our community. However, this community of practice has now about 130 subject matter experts who, those of you who have watched before with us, you'll see many of them here. We started with 60, it's grown to 130. And you can see that there are contributions from the Discovery Channel documentaries that we have produced and a number of noteworthy leaders. You see Bill George, a former CEO of Medtronic, EMTs, college students, but also some of our top leaders in healthcare. My dear friend and partner at Harvard, Professor Christensen, Jim Collins, the author of Good to Great and Built to Last, and a number of great books. And Jim Bajan, even an astronaut who led patient safety for the Veterans Administration Hospital. We undertook a study of over 1,000 families of essential critical workers focused on readiness, response, rescue, recovery, and resilience. And these are just some of the organizations that had participated with us in this study, where we were studying how can we get better educational information to families like yours to help deal with this crisis. Our focus was on head, heart, hands, voice. What do you need to know? What do you need to feel? That's your heart, because that motivates us to move. Hands, what do we want you to do? And voice, what can you share with others? And although we won't cover the topics, we recommend that you go back and watch some of our programs as we focus on that. Finally, as of this month, we've done 42 90-minute broadcasts and online programs combined for families and for professional caregivers, and 22 of these Survive and Thrive training programs. You'll see a number of the other activities, and you can go back to watch our videotapes to see the other activities that we had. I guess most importantly is that we'll continue until the crisis is over, and we don't think it's over yet. So we'll continue to update videos on masks and the latest CDC guidelines and a number of things as we go through it. The Survive and Thrive guide started with coming home safely. And as you can see on this slide, we covered a number of topics, and we're looping back today on emergency rescue skills. You see on the second row, second in from the right, that emergencies are happening continuously. Our safety net is absolutely stretched, but you'll see a number of other topics that we've covered, and we will be covering. We'll be covering fraud in the COVID ecosystem next month, COVID safe practices. We'll do an update on our 1,000 household COVID study, and finally, faith-based COVID leadership in the next 3 or 4 months, and hopefully the crisis will be over. We also have a wonderful team of students and young leaders from high schools, colleges, and young singles who are now working in the community that have helped us focus on what we can do through our youth and our young people to have impact. So that's enough with in terms of our background. We're right on time now at 50 minutes after the hour. Just want to remind you that we do and we are focused on helping families understand and deal with a lot of the crises that are going on. Now, we always try to cover things that are in the news, and we're collaborating with a wonderful professor, a tenured professor at USC Film School, and we will be working on our documentary with him, and actually a learning program for folks to apply what we learned from COVID to the next pandemic. But they have produced the most wonderful film addressing vaccines. It's called Team Player. It was released this week, and you can see the link below, totally free. And it was produced in collaboration with Los Angeles County, and it addresses the latest issues on vaccination. So I just wanted to give that pitch to you. Okay, so what's the state of our public safety net and these multiple players? Let's kind of address really kind of what's going on. Many of us live our lives, and until we have an emergency or a crisis, until we're burglarized, until a crime is perpetrated against us, we have a fire, we've got to go to the emergency department, or we have to become a good Samaritan. Most of the time, we realize, we think that there's a safety net under us, and we hope that there is. Now, this safety net has really been stretched. And what I'm going to do is share just a couple of minutes of a clip of a metaphor that we will be using. This is a metaphor for the documentary that we'll be using for this, the film that I described. So these are some close-up shots. It'll go by pretty quickly, so I thought I'd give you some close-up shots. On the left is somebody that fell through a hole in the safety net of performing in front of a live audience. And the other is one that was a near miss of the safety net and resulted in trauma. And that one of the things is our safety net has not evolved to deal with a lot of the crises we have today. So most of us believe that people are working tirelessly to improve and build our public health safety net. However, that's not happening. We've lost 1 in 5 caregivers. Chief Adcox and Vicki King will tell you how difficult it is to recruit law enforcement officers. Dr. Morris will be addressing the challenges that we have in terms of getting the people in place and hiring the right people, training them and promoting them. And most of us think that, there are people working on our community safety net. That's not really the case. We've got a pretty archaic one, and the COVID challenges have really shown us that our public health safety net's not been very good at all. We're 60th in the world on our effectiveness, and you see this terrible accident of a guy falling through the net. Unfortunately, there are holes in our net, just like you see in that videotape. There are holes in our gaps in our net that are happening. And as you see this now in slow motion, we kind of put it together for you in slow motion. You could see that there is a hole. The fellow went right through that. And that's what we're having to deal with now, is holes in this safety net. And here's the fellow really going through it. So today, what we want to talk about is there are gaps in law enforcement. There are gaps in firefighting, there are gaps in our emergency department. So what can you do to prevent an accident like this? And if you watch this one, they missed the safety net. Why? Because it wasn't completely under what they're doing. Here's another one where you've got somebody falling off of the edge of the safety net. Our safety net has evolved slowly. Our society has changed. Many things are new, and I hope that our speakers will address some of those things. And so not only do we have gaping holes in our safety net's not covering all the things that could potentially happen. This is the Walinda family who are performing without a safety net. And so, I know these are traumatic, and I didn't show too many graphic images, but what I wanted you to realize is that we really do have problems with the safety net, and it's really important that we recognize that and we kind of know what's going on. Working with Chief Adcox and Vicki King and Dr. Boats, we've identified that there are inside and outside threats, those intrinsic to our family that put us at greater risk. There may be some conditions that we have in our families that make our inside threats a little greater, and the outside threats are those that are in a community. And in COVID, but also with emergencies, the outside threats can have a greater impact. Our goal is to create resilience building, and that's really what we're trying to do. But right now, staffing shortages with COVID have increased the outside threats, but it's also increased the risk to our families of getting timely care, early diagnosis, and addressing the things that might be intrinsic to your family. What does that mean? You've got to become the chief family officer in your family and kind of address those things. So how do we deal with the family medical emergencies as we look at the emergency department? And you see now we've got a call out there to really kind of address those graphics. Well, we're really pleased to have Dr. Peabody, Dr. Toff, or Christopher Peabody. He's an associate professor of emergency medicine at UCSF School of Medicine, which is a top 10 medical center in the United States. We're blessed to have Chief Adcox and Vicki King from the top cancer center in the United States. And so we've got top 10 folks here to speak. I've known Toph Peabody since he was a third-year medical student. He's now the director of the UCSF Acute Care Innovation Center, and absolutely terrific young man, a great leader who's done a great deal of wonderful work, and we see him as really one of our guiding stars of our MedTech program, along with two other chiefs that we have of emergency departments, and that's the Mayo Clinic with Dr. Casey Clements and Dr. Chris Fox of UCI. So let's hear from Toph Peabody regarding these issues that pertain to the emergency care. I worked with Toph to identify the 5 rights of emergency care. We have the videos that where you can hear him describe them, and me describing making sure to go to the right provider, getting the right diagnosis and the role you can play, the right treatment, the right discharge, and the right follow-up. In the slide deck, which I won't read, you can read in more detail what these are about and watch the videos, because we want to get to our speakers. And so we have 3 or 4 slides that kind of give you some of the detail that we've articulated in this program. So let's hear from Dr. Peabody today. And he recorded this yesterday because he is so busy in the emergency department.
Hello, everyone. Thank you for having me back. I want to talk to you first about kind of the secondary effects that we've been seeing of the COVID-19 pandemic. Now, as all of you know, we've been sacrificing each and every one of us for the last 2 years. No more so than in the safety net system of the firefighters, the EMTs, the paramedics, the police officers, your emergency physicians, all the ED staff that comes together to take care of folks in emergencies have felt this pandemic to their core. And to be honest, and we're not unique among the rest of the country, we can no longer staff our emergency department. And that is because of a number of factors, but one of them, and a big one, is the burnout that we're all feeling from taking care of patients with COVID-19 and the effects that it just has on our daily lives to go on the front lines day after day during what seems like an endless pandemic. And so our emergency department is now having to close down beds that backs up into the waiting room. The hospital cannot staff the entire hospital beds. And so we have patients waiting for beds in the emergency department that are admitted to the hospital. This spills back, right? And so we have patients in the waiting room, and we also have ambulances that we have to turn away because we don't have the staffing to be able to receive patients. And so you see this kind of backup throughout the safety net. And not only were in the last Omicron surge were staff members sick and had to call out for their own safety and the safety of you and your loved one to not spread the virus. But this pandemic has taken a toll, and the toll is embodied in the fact that really caring, diligent people can no longer serve on the front lines. And so they've had to step back and take a break. Some have left the profession entirely. And so we're seeing those effects now, the secondary effect of the next wave of this pandemic. And so the social safety net is definitely bruised, but we're still here for each and every one of you. And so I'd love to talk more about what to do in case of an emergency. My advice to families, given these gaps in the public safety net, given our ambulance diversion rates, given our wait times in the emergency rooms, is that folks are here to serve. And we're here to serve our communities, and we want to provide emergent care 24 hours a day, 7 days a week, nights, weekends, and holidays, just like we always have. And we are here for you. And so when you have an emergency that requires the services of the emergency department, please know that we will be there. We will be open. However, please also be patient with us. Please understand the tremendous amount of pressure that we're under. We are all short-staffed. There will be more waiting than there has been. And so when you're making the choice of to go to the emergency department, if you have a true emergency, we're going to welcome you with open arms. But just know that there may be some delays in the care for things that are that can wait. We will get to every single emergency and triage in the best way that we can. So do not delay. Go to the emergency department when you need us. That's why we're here. But please note and please be patient if you come to the emergency department with a non-emergent condition, because there will be delays. The 5 rights of emergency care are even more important now with the safety net being so stretched. So just as a reminder, we have the right provider, the right diagnosis, the right treatment, the right discharge, and the right follow-up. Many of our states, especially in California, haven't necessarily changed our visitor policies. And that's from a state mandated policy. These are going to be changed and revised in the coming weeks, I've been told. But it's been really hard to operate with without visitors in the emergency department. A lot of times your loved one, your family member knows you the best and can advocate for you, especially when you're not feeling well. They're also there to kind of help receive the discharge instructions, the reasons to come back to the emergency department. I really stress in the 5 rights, understanding that your discharge diagnosis and your discharge instructions may be one of the most important parts of your visit. So you can have an entire emergency department workup and treatment and be released to home. But what happens if things don't get better once you're at home? That's the information that you really want to get a hold of. And it's some of the hardest information to get during COVID because you don't have your loved one with you, because visitors aren't necessarily allowed in emergency departments. And so how do you prepare for your emergency visit, and how can your loved one advocate for you while you're apart, while your loved one's not allowed in the ED? And that may be you advocating for your care team to update your family. And so when you're being discharged, understand your discharge instructions, understand your diagnosis, and first and foremost, understand the reasons to come back to the emergency department. The question is, what do families need to do if there's another surge? I think this concept of guarded optimism is one that I'd like to emphasize. Guarded optimism meaning we hope there's not another surge, but we'd be fools not to prepare for one. And so the best thing that you can do to prepare for another surge, which invariably may come, is to get vaccinated. Ensure your entire family is vaccinated and boosted, to understand the new CDC mask guidelines, to understand what your personal risk tolerance may be, to understand what's a high-risk environment for contracting COVID-19. But first and foremost is the vaccinations. These vaccines work. They're the best tool we have to prepare and prevent another surge like we saw with the Omicron surge. And so I cannot predict the future. I hope that we don't see the deadliness of another variant, of another surge like we just went through with Delta and Omicron, but we'd be fools not to prepare for it. So prepare your family, make sure you're vaccinated, make sure you follow the guidelines if another booster is needed. What is your advice regarding the immune-compromised family members going forward? Now, I know this group fully understands the details of rapid antigen testing for specifically immune-compromised individuals. And so I won't belabor that point. But what I would like to just emphasize, if you have an immunocompromised family member or you're immunocompromised yourself, remember you're a lot higher risk. Not only you're a lot higher risk of complications from COVID-19. And so your precautions are going to be different from maybe the general population, which if they're vaccinated and boosted, may elect to go to more indoor dining. What I would recommend is that you want to avoid poorly ventilated indoor areas. You may want to continue to mask more and use high quality masks that I know we've talked about in this program before. And just know that you're at much higher risk still of having complications of COVID-19, and take the appropriate precautions. Anything you can do to prepare for an emergency will pay off in spades should that time come. And so having a checklist of your medical conditions, having your medical records available, having the emergency contacts in your phone updated, especially if you live alone, especially if you're away for college, especially if you're a senior or you have a senior in your family that's living alone, that doesn't necessarily have a family member constantly by their side that will be their advocate and source of information for the emergency team that's going to take care of your loved one. Having all that information in the appropriate place, easily accessible. For a lot of us, that's updating the medical alert portion of our phone, which we as emergency team members know to access that first and foremost when someone comes in by ambulance. Knowing what your goals of care are should you face a life-threatening emergency. Updating your POST form, which is what your goal, having that goals of care discussion with your physician, even over a telemedicine visit, would be a great place to start. Just understanding what your goals are for care in a life-threatening situation really helps out your emergency team. Understanding what your past medical history is, understanding what medications you're on, all of these things are really, really helpful to providing the right care at the right time for you in the emergency department. And so please take these steps now. This small amount of preparation could help save your life. Why is Good Samaritan care training important? Why is it important that everyone gets CPR AED training? Why is Stop the Bleeding training, pressure tourniquets, wound packing, knowing how to use EpiPens, and knowing how to use Narcan important? We have a phrase in emergency medicine that the emergency care starts in the field, which means that the moment an emergency happens, like a cardiac arrest or someone becomes unresponsive, it's what happens really before you get to the hospital that may actually dictate how well you survive, or if you survive at all. And so when you are training and learning CPR, how to use an AED appropriately, how to use a tourniquet and stop the bleed, or how to revive someone with Narcan. These are all life-saving skills that you as a first responder or bystander can use with your family members. Now, I know, Chuck, you and I may be on the extremes of this, and you were kind enough to help my family get a hold of an AED, which I have at my household. And that's because we have a lot more family members now. I have 2 young children, and my sister-in-law just moved into the house next door to us. And so I feel an obligation as a physician and to be prepared for my family members should they have a life-threatening cardiac arrest, for example. And so I have an AED, I have a Stop the Bleed kit, I have a lot of first aid supplies that are in our household. We're starting to teach other family members how to use these, how to do CPR, how to use a tourniquet appropriately, and how to revive folks with an EpiPen should they get anaphylaxis, or with Narcan should there be an overdose, an unintentional overdose in our community. In San Francisco, where I work as an emergency physician, we've had more deaths from fentanyl overdoses than we have from COVID-19. So let me rephrase that. there's been more deaths from opioid overdoses than we've had from COVID in our city during the last 2 years. And so Narcan saves lives, and we've saved a numerous amount of lives with the reversal agent for opioid overdoses. This is something that we should all learn how to do. It's something we should all carry in our cars if we can. It's something that we can help and save a life with that first response, that golden minute, of what do we do right when we notice an emergency. It's call 911, assess the situation, know how to do CPR, know how to use an AED, know how to use the stop the bleed kit, know how to use an EpiPen, know how to use Narcan for reversal. Those are great steps, and I'm so proud that you guys are learning this. And Chuck, it's amazing that your organization is providing these resources and trainings for free, and getting certified, and getting the right tools in households so that you guys can be leaders in an emergency. And so we thank you for that.
So we're so appreciative of Dr. Peabody, and just we want to get to our great speakers. However, go to the slides and read them carefully about the 5 rights that he covered. We provide them in more detail, and we've got videos that cover them as well. And this can really help your family with what you need to do. It's now a real pleasure to introduce Dr. Brittany Bartow-Owens. I've known her since she was a little girl. She's now a community pediatrician. She has provided terrific content to us throughout the last 24 months, and she'll just provide a quick, short update as to what we might need to be thinking about our children and emergencies. And those of many of us have younger kids. Many of us have older kids that are taking care of younger kids. Brittany, thank you so much for sharing your time with us today. You've just been a godsend to us to help us understand in the community what we need to know about pediatrics and how to take care of our families. First off, with this stretched safety net, what do families need to know about getting their children to the emergency department and seeking emergency care?
So I think the first thing to recognize is, the emergency rooms are stretched thin, but you still have your pediatric office to ask questions to as well. So whenever you're concerned that your child may need to go to the emergency room, call your doctor's office and let them triage and help you. A lot of the time, parents think that kids need to be in the ER when they actually don't. So they, use your office as a way to avoid that ER if you really don't need to go, and to provide you with good care for your child.
Fantastic. What a great tip. That's a fantastic tip. If they do need to go to the emergency department, what do we need to know about it now, post-COVID and post-Omicron? Hopefully we won't get another surge, but we might. But we know that the emergency departments are really stretched. What do we need to know about taking our child to the emergency department?
So there will be, for non-emergent emergency room visits, that's kind of a funny phrase, but for ones that don't need immediate care, there aren't as many nurses and they are more stretched thin. So just having patience, if your child has, needs stitches on their forehead, recognizing that the nurses there are working as hard as they can and allowing them the space to care for your child, and not being angry with them for taking a long time. Aside from that, it should hopefully be the same care. It just may take a little longer for those non-emergent cases, recognizing that you're probably waiting because another child needs that immediate care and you would want that same care if it were your child then.
So we've developed a tool from the original SBAR tool, which was situation, background, assessment, and recommendation, which was a tool that nurses used to help communicate emergencies to doctors. Started out in OB, and Kaiser had started. I wrote an article about it, and then we wrote an article about SBAR for patients, where we say, here's the situation, here's the background, here's what my assessment as a parent is, and here's my request. Is that a reasonable framework to organize your thinking? Because it's so hard to now communicate and everybody's so stretched.
Yeah, absolutely. I think that's a great way to organize like how you're trying to present things to other people. That's great.
Brittany, what are the biggest myths that you have to dispel regarding this whole COVID situation and vaccines and taking care of our families?
Right. So there were a couple pieces of misinformation that came out pretty early on the vaccine that I think made parents reluctant to get it. First, that especially for all of these young girls, a lot of them just about to go through puberty, people had heard that there was infertility associated with the vaccine. There are a couple, there's no plausible way for that to happen. There are, in every vaccine, we've never had any issues with infertility, and it's something that's in your body for such a short period of time that it doesn't really make any sense. They actually did a study on it because there was so much misinformation about it to try to relieve people's fear about it. And they found that in a group of people that were trying to get pregnant, there was no difference whether or not they had the COVID vaccine and having a successful pregnancy. They actually found that COVID made men temporarily infertile. So COVID vaccine didn't seem to cause any issues. The COVID infection itself did. That's a big one that I get. Some people also don't want to get the vaccine.
There's a risk to unborn children. There's a risk to moms, and there's risk to potential dads from COVID, and not a risk to all three with the vaccine. Fair statement with the mRNA vaccine?
Correct.
Okay.
So other people had hesitation about it being, not needed because children had mild disease. But if you look at, the vaccines that we're giving children that are mandated throughout the country, the number of deaths per year from, for example, the measles prior to the measles vaccine was a lot lower than for COVID. And, just for COVID itself, maybe 66 kids would die a year. That doesn't even include the amount of mortality and morbidity that was caused by that child also spreading it. So the idea behind a lot of these childhood vaccines is to, one, protect the child, and two, protect the population. And that's what we're trying to do with the COVID vaccine as well. So children, they need it, and they do get sick, and it's also to protect the population.
Great. And so masks, the new guidelines about masks, what are you telling parents?
So I think it's good that the CDC created a framework for decreasing masking in the community and getting us less out in a pandemic mode. So I'm very excited that they did that, and that they have real metrics like, cases per 100,000. They take into account hospitalizations and percentage of hospital beds. I think that's all really nice. So I think in general, it will allow us to be more comfortable unmasking. That being said, I have the cases per 100,000 that they use is a lot higher than they previously used, not based on any data that they shared with the population. So I think it's good when you're having low cases and low hospitalizations to be more comfortable without a mask. I think I would probably want to mask indoors at a lower threshold than the CDC is recommending right now.
So basically what you're saying to our families is you'd be more likely, as would I, to want to wear a mask because they've been pretty liberal in releasing us from masks. So is that a reasonable statement for those of us that understand how much community immunity there is? And we talk about the fact that you really need to look at the community and say, what's the community immunity? If it's high and the infection rate is low and the hospitalization rate is low, it's safer. If the infection rate is higher and the community immunity is lower, we're going to be a little bit more careful. I'm going to be very careful. I've got immunocompromised people in my family. I've got a son that's been admitted twice with an overreaction to a virus, really sick one time. And so we're going to be very careful about keeping a very high quality N95 mask on and avoiding these indoor areas. Well, thank you very much. You've just been really so helpful to our families. I can't thank you enough, Brittany, and you bring some common sense to this very difficult area where there's disinformation, misinformation, and malinformation. So you've helped us kind of clarify the murky waters.
Sure. You're welcome.
Take care. So that's the latest from Dr. Bartow. We have a slide covering these concepts of misinformation, disinformation, and malinformation. If you want to look at a framework, this is a great framework. We won't go into it today. What do we need to know about EMS? Well, the issue is that they're as stretched as badly as what we hear from what we heard from Dr. Peabody. And I want to make sure that our live speakers get a chance for enough time to speak. We'll loop back with Dr. Boats regarding a statement regarding the EMS. But enough said is that they're experiencing the same thing that you heard from Dr. Peabody. We've had a huge number of caregiver deaths, and now they're not even counting them. So many websites have not been counting them anymore. And we have 1 in 5 healthcare workers that have left healthcare. However, we've had an enormous number of deaths, an enormous number of people with long COVID who've not been able to go back to work. So the combination of those two things have really hurt us in terms of EMS coverage. So it's important to realize if you're in a metropolitan city, EMS will take longer to get to you. So the more prepared you are to take care of a loved one and get them to emergency, the better. Be aware they might be sitting in the parking lot of the hospital waiting to be seen, or they might not be able to go to your hospital because of diversion, as you've seen. We've covered in prior webinars, which we won't cover today, that there are skills that you can maintain to make sure when you're taking somebody to the emergency department, having a pulse oximeter at home and being able to manage it, masking up, and then making sure that you've got good ventilation in the car when you go to the emergency department. And then, as Dr. Peabody had said, after discharge, making sure you have everything you need and knowing what the discharge precautions are, getting the proper medications and the proper equipment at home, and being aware of the fact that somebody's going to have to do that if people are feeling sick. So we're moving now to talk about law enforcement and what's important to all of our families. It's interesting to know that at the last count, we had 5 times as many police officers dying from COVID as from gunfire, which is pretty amazing. We're going to ask Vicki King, who's the Assistant Chief of Police for Converged Threats and Risk Protection and Investigations at MD Anderson Cancer Center and the University of Texas Health Science Center, speak together with Chief Adcox. Chief is a Vice President as well as a Chief of Police for the University of Texas at Houston, that is providing the protection for and really the major player at Texas Medical Center, and who we work with on a daily basis, a co-founder of the MedTech program, a co-founder of our Emerging Threat program for top medical centers. And we're going to ask them to kind of give you a quick snapshot of what's going on in the police and in law enforcement, and then what you really kind of need to know and realize as you think about your family, but think broader of your community and why it's so important that we not defund our police and our public safety net, but actually fund the right players and the best players. So I'm going to stop sharing right now and ask Vicki King to speak and kick off. Vicki has also been the Assistant Chief of Police in Houston and had all of the departments reporting to her. A wonderful and thoughtful, I believe, academician in this space, and somebody who has always been a great speaker for our programs. Vicki, would you kick things off?
Thank you, Chuck. I will. I'm going to share my screen. And Bill and I have decided that we're just going to team teach this little session, and each one of us will take a part of the presentation if that works for this group. So I'm going to let my my compatriot here and friend and mentor Bill Adcox start. First of all, can you see our screen?
Yes, ma'am.
All right, so Bill,
Vicki.
kick us off.
Well, thank you very much, Vicki, and thank you, Dr. Denham, and everyone that's on the program today. And most of you are, we're going to try to kind of give some context to what we're talking about here in terms of this erosion of police services and the safety net, public safety net. Most of you are fully aware of the tremendous increase in violent crime in our communities. But you may not be aware that we're really faced with what could be called a perfect storm. That perfect storm is not only crime, but it's the actual erosion or shrinking of that public safety net. So what Vicki and I are going to do is we're going to walk you through a data-driven overview of what we're talking about. We're going to highlight the healthcare issues that are in play during Omicron or the pandemic and this crime increase, and then we're gonna talk a little bit about the impact, and then real briefly talk about some areas of improvement or some solutions perhaps that we can look at. So if we go to the next slide, Vicki, and if you can go from there.
All right, thank you. Well, we all know that COVID-19 turned our worlds upside down. When we start to look at the impact of COVID on healthcare and its relationship to law enforcement, we know that our healthcare communities are target-rich environments. And pre-COVID, there was workplace violence that was raging, especially in our emergency departments, where affective violence, that momentary rage sometimes can spill over into a violent event. We were also cognizant of cyber attacks, ransomware, the denial of service that was occurring, and data breaches. Those were things that we were combating at an institutional level to try and build up our firewalls and protect our PHI and our communities. We also were aware of insider threats, drug diversion, patient safety, PHI breaches, theft of intellectual property. Those were framed in terms of sometimes careless acts by our community of care, individual actors, and then there were those coordinated malicious actors that tried to harvest the very lucrative PHI information that was available in our hospital IT systems. And then, of course, theft and fraud, grant research fraud, Medicare insurance fraud, and criminal enterprises trying to garner prescription drugs for illicit use. Those were already in our pre-COVID threats that were targeting our healthcare institutions. But there was another layer post-COVID that began to surge up. Workplace violence in the emergency rooms began to take a different turn. You had those who opposed vaccines. You had a politicization of treatments and types of treatments. Domestic violence. There was much more domestic violence presented in our emergency departments and even among our staff or victims, and sometimes those incidents would spill over into the workplace. But it was, what we're seeing is increased volatility by patients. Just because you become ill doesn't mean that the world's problems that you had on at home, you didn't bring those with you. And when you're in that high stress environment, clearly it's going to put you closer to an effective response, a violent response to frustrations, wait times, some of the other stressors that you may see in the healthcare environment. The cyber attacks, certainly in today's world with the political, geopolitical situation with the Ukraine, cyber attacks are real. You can have state-sponsored actors, but you also have predators and these individual hackers who come in, and they're targeting. We saw a gigantic influx of false and fraudulent workers' compensation claims, as well as the unemployment claims that were hitting many of our healthcare institutions, malware, Trojans. And this is exacerbated by the fact that many of our administrative staff were sent to remote work locations. So they were no longer within the protection of the firewalls. And in the at-home environment, sometimes they were a little more careless with our IT and what emails they clicked on. So that added a whole new layer of complexity. Certainly the insider threat, the theft of PPE began. PPE at one time was abundant. It was something that you didn't think about protecting. And then it became our most treasured commodity. when the supply chain was disrupted at the beginning of the pandemic and people were desperate to protect themselves and their families, there just weren't sufficient stores to meet the needs. You saw many of our healthcare workers having to improvise or reuse, recycle PPE, which certainly doesn't work in to try and keep yourself safe from communicable diseases and other pathogens. And then theft and fraud. The black market for PPE and supplies, Medicare, insurance frauds, COVID testing, and all these treatment schemes that went out there. The snake oil salesmen were in full force when we had this. And so you have those COVID threats. Now you overlay the criminal justice system, the environmental impact. So we saw court delays because they couldn't hold court, and it took a while to catch up with the Zoom and allow the laws to evolve to meet this new remote meetings on motions. We also saw compassionate release of jailed offenders, which from a compassion standpoint, it certainly tugs at the heartstrings, but it was indiscriminate and a blanket response rather than allowing those offenders that represented the least threat to society. It was an all or nothing approach. There was also a reduction in new jail admissions. You saw district attorneys not prosecuting certain types of crimes. You saw no bail or low bail that was out that allowed people to get out. And then you saw something that was really new, that people who committed subsequent violations of their bail or subsequent crimes while out on bail were continually granted new bail. So those things were extremely problematic in combating the predatory acts of a very slim percentage of our population. From a law enforcement standpoint, you saw social distancing practices. It's very difficult to interact with the public well when you're trying to keep that personal safety, and especially when there wasn't sufficient PPE to go around with our law enforcement communities. You saw a shift to taking phone reports rather than in-person reports and evidence collection at scenes, evaluation of scenes by law enforcement. And then you saw a reduction in the arrest of offenders. There was fewer proactive policing measures that were taking place, including traffic stops, suspicious person stops, Terry stops. Those things all contributed to this tsunami that we see, and a real lessening or erosion of our safety net in the criminal justice system. Bill?
So then on May 25th of 2020, right during the pandemic, we had this a horrible event where Mr. George Floyd was murdered by 4 Minneapolis, Minnesota police officers. They knelt on his neck until he died. What a horrendous and tragic event, but it really ignited communities across the United States. This police brutality and social injustice, racial injustice, really took off, and you saw widespread actions against policing and lots of pushback. And as Dr. Martin Luther King Jr. Has stated in his letter from the Birmingham jail in 1963, an injustice anywhere is a threat to justice everywhere. We are caught in an inescapable network of mutuality, tied in a single garment of destiny. Whatever affects one directly affects all indirectly. Those words have never been more true than they are during this event and throughout what's happened post that event. So this really ignited this whole movement, and had us all have to take a really close and justified look at policing. Unfortunately, there are some unavoidable impacts, as well as some things that can happen that were not thought of. And this is, we'll talk a little bit more about that, but it was really a horrible thing where the police officers are supposed to be the guardian of peace. They're supposed to be the facilitators of justice, and they're supposed to be the protectors of the vulnerable. And so they had to go back and really revisit this. And you go from May 25th of 2020 to where we are today. Next slide.
So as calls to defund the police and abolish the police began to grow around the country, Gallup initiated a panel, and I think that this was extremely illuminating. Our Black Americans were surveyed, and they said that they wanted the same or increased levels of police presence in their neighborhood. So the slogan of defund the police and abolish the police, that's a great rallying cry, if you will. But in reality, there was a recognition that 81% wanted the police to stay or increase in their neighborhoods. Just 19% of Black Americans surveyed in this poll want police to spend less time in their neighborhoods. And these figures are fairly consistent, and they align with the earlier surveys that found that 22% of Black Americans, only 22% wanted to get rid of the police or abolish the police as we know them. So serving the community was what they want. All Americans, Black, white, Hispanic, Asian, we all want to live in safe communities. No one wants to be oppressed. No one wants to be abused. They want to feel safe and secure in their communities. And so some of the fringe elements that we're calling for the defunding or the abolishment of police, that may sound great on a placard, but the unintended consequences of that are severe. Unfortunately, some of the community politicians took it to heart, and the defund the police movement can see to correspond with the rapid rise in crime. FBI data shows an unprecedented spike in murders across the nation in 2020. Now, we don't have the FBI data for 2021. We can see the trend data that 2021 is even going to exceed the levels of 2020. So as this mantra began to cross the nation, the reduction and erosion of police services had a very visceral effect in the communities. Blood was shed and lives were lost because police were not there. And if you want to break it down into our urban environments, the FBI actually looks and tracks this data by city. And you can see, is your city on this list? What was the increase from 2019 to 2020? What occurred during this abolish the police movement? And what does the data show us that was the impact of this rhetoric that was pushed forward? We can also look at the number of arrests. Police began to pull back. You saw more retirements than ever before. You saw police officers leaving the profession more and more and in greater numbers and leaving those communities. And what that resulted in was unsolved crime. Arrests did not occur. And what we forget to think about are all those untold victims and their families who were left in the wake, suffering with no recourse. And if a predator is allowed to escape, the result is that predator is not going to stop until there's a consequence with their actions. And so crime is moving up and arrests are moving down. And, the officers pull back. The police officers also suffered a tremendous burden with assaults of police officers, unprecedentedly large assaults. These are just the deaths. This is not just the number of police officers who were attacked during this period, because the numbers are still very, very in flux. But you can see there was a 58.7% increase in murders of police officers while on the job protecting our cities. That number is just astounding. And for myself, who has a daughter and a son-in-law who are also police officers, as a parent, my heart is just in anguish when we see these happening within our communities. So Bill's going to walk us through kind of the full breadth of the stressors on policing. Bill?
Yeah, yes. So there's a multitude of things that are going on that are causing the nation's shortage in police staffing. Obviously, the COVID-19 issues come into play. We talked about that. The anti-police rhetoric is in play. You're seeing surging workloads on top of everything else. One of the key issues is they talk about abolishing protections. They talk about end of qualified immunity. However, you need to put that into context. Any police officer that's conducted or is involved in wrongdoing can be prosecuted. This qualified immunity is a court ruling that talks about any and all government workers. It's the same exact qualified immunity for teachers, sanitation workers, parks and recreation attendants, you name it, it's all together. And what they're talking about when they talk about abolishing or ending qualified immunity, quite candidly, it is not correct in the way that the proponents are talking about it. And it really needs to be looked at in terms of what the real meaning of qualified immunity is across the board. Now, there could be some unintended consequences also in doing so. It opens up, obviously it opens up our cities and our counties to some very, very serious litigation, as well as police officers in the profession, whether or not they feel that they'll be supported, or better yet, have the protections for lawfully doing their jobs. Obviously, if a police officer does something unlawful, no one should be held more accountable than a police officer that does wrong. There's no doubt about it. There's increased dangers with police officers. Vicki talked about the last slide where there's 58.7% increase just in the murders of police officers from 2019 to 2020. And then there's the reduced accountability we talked about in terms of individuals that are committing crimes in our communities for a multitude of reasons. They're there. So what you're seeing here is just a slide that really kind of talks about it. And frankly, there's a tremendous reduction in the labor pool for people that would want to become police officers. We're seeing a tremendous reduction in the amount of people that even would ever apply to be police officers. And that's a growing trend. And I believe Dr. Morris could probably talk more to that. Next slide.
So when you look at what that means for our communities, the International Association of Chiefs of Police did a 2021 survey, and these were the results. They found that 78% of agencies reported difficulty in recruiting qualified candidates. They just couldn't cut through the rhetoric to get people interested in applying for those jobs. 65% reported having too few candidates applying to be law enforcement officers. This is a complete turnaround from when I applied, and there you had for one open position, you could have 100 to 150 applicants for that one job. There were 75% of agencies reported recruiting is more difficult today than it was 5 years ago. And think about all the stressors. Would you ask, or would you want your children or your family members going into this profession? The family support is not there anymore that really drives our recruits to choose a career in policing. 50% of the agencies reported having to change agency policies in order to increase chances of gaining qualified applicants. Now, that could be something as innocuous as allowing officers to wear beards or have facial hair, to something a little bit more concerning when it comes to character, thefts, reduction in previous convictions for misdemeanor convictions, poor driving habits, marijuana or drug use. And so when you start to see those in some of the backgrounds, especially when you start talking about theft convictions and things of that nature. That really speaks to character and temptation, and whether or not that person's going to be able to resist in the workplace. So officers talk about it in terms of lowering the standards for hiring police officers, and that is a concern. And then 25% of the agencies reporting having to reduce or eliminate certain agency services. And this means units, positions, because of staffing difficulties. We've seen it here in the Houston area. We saw it in Austin, probably in Texas. The most profound was back in November of last year. The Austin Police Department announced that they would no longer send officers to non-emergency calls. And so that means if your business or your home was broken into, they were actually telling the citizens to document your own break-in, preserve your own evidence, and collect your own evidence. Well, what does that mean? How do you submit it? How do you get it analyzed? How do you have the case investigated? And how do you hold someone accountable if a police officer hasn't conducted an investigation? So those are the reductions in erosion in services. If you're asking citizens to investigate their own crimes and you're only going to be there if blood is running in the streets, then there's going to be an even greater crisis of confidence in our law enforcement profession.
So although what we can talk about is how policing is in fact at a tipping point, we really want to change the narrative through talking about accountability and professionalism measures. We're talking about going back in and repairing the safety net and making it stronger. Now, this is not an all-inclusive list, but these are some things that, you know, on the upside, on the positive, that needs to be done and can be done. You know, first and foremost, the foundation about policing today is around hiring and selection of your employees, and they really need to be reflective of the community. One of them is diversity, whether it's just truly reflective of your community, whether it's individuals that happen to be persons of colors, people that happen to be white, people that happen to be from different sexual orientations, individuals that are across the spectrum. We're talking about overall diversity that reflects the community that you've sworn to serve. In addition to that, you need to make sure that you have you really truly need to push really heavily for having more women in policing, and because really 12% of policing today, 12 to 13% across the nation is women, and that is horrible. That is ridiculous. And you really need to have more women in policing. And there's many studies of why that is critical. And then a real critical component is when you get that diverse workforce to come in and want to be police officers, you've got to look at the character issue. You have to have an ability to screen individuals, making sure they're of solid, good character, that they aren't racist, Vicki, did something happen to the screen? That they are not racist, and that they are not thieves, they are not sexual predators, and that they are not members of extreme groups, extremist groups of all types that are just horrible and don't reflect what this great country represents. That's a critical component. We need to have early warning systems in place, and very importantly, we need values-driven corrective action processes. Quite candidly, we try to focus too much in policing on the conduct of the officers, but we really need to look at their overall behavior and making sure they're comporting themselves every day with the values that the community demands and expects and is absolutely necessary to do the job. And you need to have policies in place that allow you to hold them accountable to that. And again, you're talking about development. You're talking about making sure that they can do that. One of the next important component, obviously, is constant development of your personnel. You get the right people in the front door, you get the right development, you're going to get the right people that you can promote. You've got to have the best promotional systems in the country. That I'm going to leave to Dr. Morris, because I don't know anybody in the country that's better at doing that and doing it right than Dr. Morris. And then you must have an ability to retain the competent employees, the best employees, and particularly developing and retaining leaders of great character. And that's going to be really strong. Accreditation and oversight. Less than 6% of the nation's police departments are accredited. and that is a set of standards. Accreditation in of itself is not the answer, but it is a part of the answer, and it is giving you the standards, and it is helping to develop a foundation, and then having oversight of police organization. Listen, you really need to be, as a community, you need to be part of your police departments. You need to be part of the oversight of the police departments, and having these checks and balances in place at all times. That is going to be critical, to have that oversight of those policing organizations. And frankly, this is not popular in a lot of police agencies, but I will tell you that police unions need to be redirected and focused on areas of safety and compensation, things of those natures that makes the workplace better. But management needs to have a stronger ability and retain authority over work assignments, the types of things that they're going to be asking these officers to do, as well as a strong ability to take corrective action as quickly and as appropriately as possible, certainly with due process. But you've got to be able to, as a manager, take the necessary action to get it done. And then I'll let Vicki take the next bullet.
Right. When we talk about building social capital with our community, you create that transparency and inclusion with your community stakeholders when those interactions are when you're not in crisis. Building those social capital, there are a number of really good programs that I've been a part of throughout my career. But it is when you reach out and you make those connections with school boards, with PTAs, with sporting groups, our youth sports groups, when you're constantly contributing to our NAACP, our LULACs, our ACLUs, when you're connected with those individuals and you hear and you listen and you have those informal exchanges every day you're building those relationships. When things go in crisis and they know that they can pick up the phone and call you, and that you're going to tell them the straight scoop, that you're going to tell them if your officer is messed up, hey, look, we've got some concerns here and we're going to look into them. They'll stand with you when you have those events where an officer did not live up to our community values. And they know that you're going to take strong corrective action to make sure that your officers represent our Constitution, we value the civil liberties of those we serve, and that we're here as guardians and protectors, not as enforcers. We also want to direct those resources to community needs and priorities. If your community is not concerned about rigid traffic enforcement on the highways, and you've dedicated most of your resources to that, and they see you stopping traffic and they believe it's a revenue generator rather than a protection strategy, then you're going to lose credibility. I'm not saying that traffic enforcement isn't important, it is. But what I'm saying is that the resources have to be commensurate with the protection of the community. And you can't listen to community needs and issues if you're walled off and you don't have those informal and you don't go to them. They're not going to come to you. You have to meet them in their community, in their environment, and listen. And if they know that you're going to listen and they know that you're going to respond, you're going to build that social capital that you need to gain the respect of the community, and the trust is the most important thing. We have to rebuild trust. When we rebuild trust and we recruit our next generation of police officers from that community, and they know that we hold those values true, then we're going to work out of this problem. There will not be calls to defund you. There will be calls to support you. And those are the things that we're trying to build in our community as we move forward. So, Bill, I'm going to let you see if there's any final questions.
We're going to move right to Dr. Morris because we're a little short on time. So we'll move right directly to him. And so if you can stop sharing, Vicki, then I will share, and we'll have Dr. Morris bring us home. And for those that are watching our extended program, we will be hearing from Dr. Cox as well, or Dr. Boats as well. And what we'd like to do is have Dr. David Morris now, and I'll be advancing slides for him. He's a forensic psychologist, an attorney, an expert advisor to public safety organizations on performance improvement. His bio is on our website, which is very impressive, as are both Bill and Vicky's. And Bill and Vicky, thank you so much for really giving us a comprehensive view of where the gaps are and why our law enforcement safety net is so important. David, would you like to kick it off here? David, are you there? If you're on mute, unmute.
Oh, I'm sorry. That was the most popular expression in 2020. I apologize for that. All right. So I want to thank you, Dr. Denham. I enjoyed listening to Chief King and Chief Adcox and all the others on the issues that we're facing in this safety net. So I am the CEO and president of a small firm that actually provides, their primary mission is to help build a stronger and more diverse public safety. And we do this all over the country, from California to New England to Florida and everything in between, over 260 agencies. I'm proud to be able to provide that service, but what I've learned along the way is that the old way that we used to test won't work anymore. And this is what everyone needs to remember when they're engaged in selecting, is that diversity is key in all your personnel decisions. Public safety is the face of government. If people do not see themselves represented in that public safety, then it is a psychological certainty that that government is courting dissension from those people. I've seen that all over the world. I've seen it in our own country. We all have. So there's where the challenge is. We want to increase and strengthen public safety using good testing procedures and good assessment procedures. And we want to do that so that, in fact, not only do we increase the quality, but we also increase diversity. So that's going to take a challenge, and it's going to challenge the traditional way of actually using assessments. So Chuck, you can give me that next slide. All right, so in the face of emergency, public safety is who we call. They're the people that come to help us. And so they're essential. It's really, they're facing numerous challenges, and we've got to adapt to these new challenges. And so we're up to the challenge. We're there. We're adapting, and we're actually achieving the diversity and increased quality under some really different dynamics that we're working with. So the next slide, please. So when Chief King was talking about when she first applied, that it would be like 100 candidates for every one selected. So if you look at this diagram, there's a few blue dots in there. Most of them are red dots. The blue dots are people that will be successful in public safety. Our challenge is to find them. The old traditional way of testing once every 2 years, we're trying to find those blue dots. That's not going to work, because public safety, like every other element of human resources, is a flowing river out there. Those dots are here today, but if you wait till tomorrow, those dots will be diminished. They will no longer be there. So next slide. So you've got to imagine that you're trying to catch and identify these blue dots among the massive red dots, because not everyone is able to serve. Research shows that about 70% of all the people who even want to be, which as Chief King has said, has really diminished a lot. But you've got to identify not only among the people that want to be, but those that can be, and those true blue dots. So you've got to imagine yourself as a fisherman, or fisher person, I should say. So if you throw that net out there today, that's good. But if you wait a year from now, the dots that were there and the good people who were there a year ago won't be there anymore. So you've got to adapt your testing. As Chief Adcock says, you've got to look at character. You've got to look at the way you do the testing. We've been able to increase the diversity of African Americans in a public safety position by 208%, not by lowering the quality, by changing the metrics that we used. We've been able to increase the the percent of women in public safety by 3 times the national average, not by lowering the standards, but by simply changing the way those assessments were worked. So when you're talking about entry level, you've got to focus on the fact that it's a river. Not so much true in promotional assessment. I would say promotional procedures, we need to do them more often than we used to. I'm working with one of the 3rd largest jurisdictions in America, and they did a promotional exam 12 years ago. Oh my goodness, I feel so sorry for these people that join public safety for a career. And yet, think about how desperate they are if in fact they don't do well on that promotional exam. So we need to see more frequent and on promotional programs and on a more regular basis. They've got to look at just more than a multiple choice test. The old standard way that HR used to do it has got to change. We've got to say we can't have multiple hurdles out there. If you didn't pass this, we're not even going to look at you. Most of assessments are compensatory. That means they may not have made exactly the best score on this test, but perhaps they're the very best on the other. So you've got to reorganize and rethink the way you're doing those assessments so that you can get the good quality that you're looking for. In fact, even an increased quality and more diversity, because both are essential in public safety. So you really want to look at a written test. Okay, that's going to be a good technique of assessing knowledge, but you've got to look at the structured oral, the constructed oral, because we know that in fact, those are where our best decision makers are. They're able to walk, talk, chew gum all at the same time. They may not be your very top best multiple choice test taker, but they are your best supervisor of men and women in public safety. So please consider those, changing the way you set the hurdles and changing the way that you set those tests. Now, while we're a small agency, we are one of the primary providers to most of the major cities in America. And we know that our goal is to push them and get them to adapt to a new way of assessing and selecting people. Also, what Chief Adcock said is so true. We used to think that you've got to be the smartest person in the room to be a good public safety officer. That's not true. You've got to be smart enough. The rest of it is character. What is your commitment to the organization? What is your commitment to serve the people in that community? So character is really important, and you can get to that multiple ways. There are actually multiple choice tests that have been created in the last 20 years. And those multiple choice tests are really good at helping you identify character, but there's no substitute for that background check. Now, what does all this mean to you? It is true that in fact, the number of people applying that want to be smaller, but they're still there. Our challenge is to find them, and we're up to that challenge. But what does this mean to you? A typical family of 4, your children, your loved ones. It means that you need the public safety to be there to help you when you need it. So anyhow, I want to thank you all for the opportunity to talk with you. Chuck, it's always a pleasure. And Vicki, it was good to see you, and Bill again. I'm just pleased to be a part of it. It was amazing to listen to everyone provide the information.
Well, thank you very much, Dr. Morris. And we are going to wrap up at our about 90-minute level, but we have an extended program with the comments from Dr. Boats regarding the 8 leading causes of death for which Good Samaritan care can be addressed. We just wanted to make sure that everyone knows that the firefighters are experiencing the same burnout. They're experiencing attrition. It's a very popular job, but they're all being stretched, especially those that are EMTs and are working that are working so diligently. We've had the great opportunity of working with them in our MedTech program, which I'll tease just for a moment, and then we'll come back to the folks that we have. On the left are Cub Scouts, actually, and our Cub Scout group is all grown up, and now they're in their mid-teens, and you see in the upper picture three firefighters behind them working on our MedTech program, which is to bring the skills to Good Samaritans and to work hand in glove with the firefighters, law enforcement, and our emergency departments. And so what I'd like to do is go back to Chief Adcox and Vicki King and Dr. Morris in just a minute. But for those that are watching the extended program or want to watch Dr. Boats kind of address what we've been doing with our Care University program with MedTech. I'll just address the fact that we have a certificate program where we're certifying EMTs, and we're teaching people to be instructors on Stop the Bleed. Many aren't, as well as CPR, and address these 8 leading causes of death that you see on your screen here today. I'm just going to kind of move through a little bit more quickly. We have 6 articles. There'll be a 7th article coming out addressing some of the things you heard Dr. Peabody address as we talked about those. But for those of you that stay on for the extended session, you'll hear Dr. Boats address why in post-COVID, and now because our safety net has so many gaps: cardiac arrested CPR, choking and drowning and resuscitation, use of Narcan for opioid overdose, EpiPens and reversal agents epinephrine for those that have anaphylaxis, Stop the Bleed for bleeding, infection care beyond COVID, because we really are at huge risk now with a lot of pathogens that are in the environment, and then transportation injuries and deaths that occur to our children every single day. We have 100 drive-overs a week. 60% are drivers that are either their parents or they know, and we have 4 deaths. And then finally, bullying. So, but what I'd like to do to keep us, for those that are doing their CME training to the 90 minutes, is not go too far over, and come back to our live speakers today, and just have Chief Adcox. Thank you for the comprehensive presentation. It sure helps to have you and Vicki share with us why it's so important to fund and to know about our law enforcement. Would you like to react to what you heard about the other groups? I think we talk a lot about the fact that firefighters, EMS, emergency departments, law enforcement, and our Good Samaritans need to work together. You want to kind of address why that's so important now, post-COVID, and as we are getting through these challenges?
Absolutely. Thank you very much. I think I'll use the example of when we talked about the spike in murders. That murder rate would be much worse if it wasn't for the fact that we now have bystander care, Good Samaritans that will be willing to take and know how to help somebody stop the bleed, give them CPR, whatever the case might be. They have cell phones that we can get locations on them. They don't have to run to a landline anymore and know where it's at. You also have the very best medical equipment, and when the EMS and the firefighters get there, they're so well trained, and some of them even have whole blood and other things. So they're able to take someone to the world's best emergency rooms, trauma 1 centers, and get people's lives saved. So when you talk about that entire safety net, it has got the very best of people involved, the best equipment, the best technology, the best leadership, and the best practices are in place. That's why more and more lives are being saved that would have never been saved as little as 20 and 30 years ago, but yet our murder rates are off the chart. So it tells us that we do need to do something about it. But bystander care is showing, obviously, that it's working, as well as the quality of the people on the front lines in knowing how to do their jobs to save a life. And so we're very fortunate to have that. We're very fortunate to have TMIT and the MedTech teaching that to every single person every day. What are the things that you can do and how you can treat somebody with the 8 most preventable causes of death. And so for that, I will tell you, it's working, and it's a great program.
Well, thank you, Bill. Thank you for being kind of a pathfinder and a threat safety scientist. Vicki, your thoughts, same question about weaving together and what we can do to bring together those strands of that safety net using the trapeze idea and the fact that, there are gaps right now because of what we've been through, but we've got to broaden the net because things are evolving so dramatically, and you're such an innovator and a creative thinker. Anything you'd like to add about how we can all work together to get these 4 strands of the net together?
Yes, and I have to piggyback on what Bill said. The beautiful thing about community and unity is that when we come together to solve a problem, there's nothing we can't overcome. And MedTech is a great opportunity to weave all and to be that safety net, that Swiss cheese, the safety net under the safety net, the bystander care that Good Samaritan can bridge the gap and help give someone in distress those extra couple of minutes when it takes your first responders to get there. when we have a safety net that is stretched and stressed, that has gaping holes in it, we have to find another way to overlay. And the bystander care is probably one of the most innovative and effective ways to help be a force multiplier in our community. So sharing that information with our community and supporting your firefighters, your police officers, and being there as their underpinnings when the going gets tough. Don't abandon them, help them. We can all as a community get through this crisis together. Hopefully COVID will not be with us forever. It's an endemic stage. There will be new variants, but if we work together to combat the problem, care for one another, using all the tools that are available so that we can get that person to those level 1 trauma centers and the best chance for survival, we will save lives.
Thank you so much, Vicki, and thank you for being such an articulate communicator of the complexity of what we're facing. I know many of our audience are families, but they're family members who have spouses and loved ones that are right up there in the front line. And you really provided, you and Chief Adcox provided some real granular detail that makes it make sense why we've got to fund things. Let me come back and the final comment from Dr. Morris. Dr. Morris, as you're so passionate about training and promotion, and we ask you to apply to the narrow scope of law enforcement, but really the principles that you describe are what we've really got to do to integrate. The way I'm kind of thinking of it is the safety net is like that trapeze safety net. It's got big holes in it. And we got to make the net broader because things are evolving. We've got a lot of new things happening. That means the net's got to be wider and deeper and longer. So not only do we miss the holes in the net, but also capture some of the new things that are happening. Is that a fair statement? And how would you like to build on what Chief Adcox and Assistant Chief King had said?
Yes, it's a very fair statement, Chuck. And there's no question that the net is in danger, but we can do it. We can actually repair it, and we can adapt to the circumstances that we're faced with. I'm a passionate believer that, in fact, public safety is an essential element of that safety net, along with the medical and other services that you've described quite aptly. The adaptations that we have to make are in place, and we're actually making sure that we adapt to that. You've got to have a stronger public safety. It has to be more diverse or have a sustainable government. And that is really where we need to recognize that we're going to have to do things differently.
Well, listen, I would like to thank all of you so much for your speaking. For those that are getting continuing education credits, this will be your 90 minutes. If you'd like to apply for 2 hours, we're going to actually play the recorded message from Dr. Boats, who's in the ICU today, addressing the MedTech 8 and why each one of these are so important for you and your family. There are gaps in the net. The first thing you could do is to recognize EMS is not going to be 8 to 12 minutes response time. And even if it is, you may be sitting in the parking lot with your loved one. We've had one of our dear close friends have an accident this week, and it does take longer. So for those of us that have families, why it's so important to learn some of these basic skills. 3 minutes from drop to shock, 3 minutes from a gunshot to or a severe bleeding event to stopping the bleeding can save lives and long-term harm. So what we'll do is we'll thank everybody right now. I'm going to just play the short clip from Jenny Dingman to close us for the 90 minutes. And then those of you that want to stay on, we're going to have Dr. Boats address the big 8 of MedTech. But thank you for our speakers. If you all have to go, we understand. Many thanks, and God bless all of you.
Thank you.
So Jennifer, would you please close us today with the voice of the patient, and thank you for all you do at Patient Safety and Quality.
Thank you, Dr. Denham, and I wish to thank all of our speakers for their great knowledge and wisdom here today. Again, I urge all of our participants to please share the recording with your friends, colleagues, family members, and neighbors, and looking forward to seeing you all again next month. God bless, and thank you all for being here.
So we want to thank those of you that want to stay with us right now. What we're going to do is we are going to now address the MedTech topics and the Good Samaritan care. Too hard to really cover all those topics in our 90 minutes, but we have a message from Dr. Boats, who will speak to those issues with us right now. And Dr. Boats is a full professor of anesthesiology and critical care at the MD Anderson and the University of Texas in Houston. He's an adjunct clinical professor at the Department of Anesthesiology at Stanford University School of Medicine as well. We are so grateful to have him as one of our leaders. He's our clinical lead on the MedTech program, and we have a number of emergency medicine doctors as well. He'll be addressing briefly why it's so critically important that everyone learn CPR and the use of an automatic defibrillator for cardiac arrest, why we can dramatically reduce the not only deaths, but the long-term effects. And we have a number of videos that we use to cover it. Choking and drowning is absolutely critical. We've got 2 years of children that have not been in swimming lessons. They're going back to pools and back to the beach and back to lakes, why that's so critically important. The opioid crisis is absolutely terrible. We've got more than 258 deaths a day. It's gone up dramatically over the course of COVID. And we have the opportunity now for the public to get Narcan and to have it available as a reversal agent, which anybody could use. And the public, and we're helping the public learn, and we are training security officers how to teach, lifeguards how to teach others, EMTs how to teach others to address this terrible problem of the opioid overdose. We know that 1 in 10 schools will have an anaphylactic event in a child where they'll have an allergic reaction to a medication, an insect bite, or a food. It's incredible how many adults have these. The Stop the Bleed program, which is part of the American College of Surgeons, is an absolutely terrific program. And we are teaching it, and we're teaching instructors now, and we've learned how to actually teach the entire program over Zoom, including using tourniquets, wound pressure, and wound packing. Infections are a big deal, not just COVID, but there's terrible pathogens in our soil and in our environment today that can lead to death. Sepsis is a widespread infection throughout the body that could start, and we have many stories that we tell on video, that can start from a simple wound. Transportation accidents are occurring constantly, and now that our kids are more active and out and about and returning to school, these safety measures are absolutely critical, and that's why we've included it as our 7th target area. And then finally, bullying, and why bullying is so critical, leading to what we call bullicide or suicide, but a lot of other terrible things that can happen as well as a result. And because there's been a lot of pent-up anger that has occurred through these issues that have occurred with COVID, we know that we've got some critical problems there that we really need to address. So I'm going to now play an overview by Dr. Gregory Boats, and then we'll close the extended session. So Dr. Boats, one of our 8 topics that we focus on with MedTech is out-of-hospital sudden cardiac arrest. Is it reasonable to say that to protect our families and loved ones, that this Good Samaritan care is important, and that perhaps more of us should get CPR trained in light of the safety net being stretched?
I think more so than ever, the bystander rescue care, including CPR, is an important component in life-saving in our communities, especially during the times of COVID and as we try to transition from the pandemic to an endemic phase. Our first responders are stretched. They don't have as many providers to cover the real estate that they have to cover, and so response times may be prolonged. We know that in sudden cardiac arrest, the most important thing is early and effective CPR. So if our bystanders can provide good hands-only CPR in the event of a cardiac arrest until our professional first responders can get there, the chances of a good recovery are so much better.
Terrific, Dr. Boats. The second topic is choking and drowning. Given that during the COVID period of almost 24 months that many children haven't been able to get swimming lessons, and now we're opening up the floodgates with summer approaching, how important is it? Let me restate that. Okay. Dr. Boats, the second topic that we focus on in MedTech is choking and drowning. Given that over the 24-month period that we've been undertaking this program, very few kids have had swimming lessons, and yet we know it's one of the leading causes of death, that drowning is one of the leading causes of death. Do you think it's important that we kind of revitalize our focus on the Heimlich maneuver for choking and knowing what to do if someone has drowned?
It's absolutely crucial that we implement our measures to manage choking with the Heimlich maneuver and other maneuvers, and the rescue care that we use for people who are suffering from drowning or near drowning, because of the factors that you suggest. Our response times are certainly challenged, and the population is not as well versed in water safety. And so we need to augment the response to those medical emergencies with bystander rescue care.
Dr. Boats, one of the problems we had before COVID, but one that has really accelerated in terms of its severity and its impact on our population, is opioid overdose. And I know you're very passionate about the fact that we all really need to learn how to use reversal agents. How important is that now, and why should many of us understand how to use these agents, given that we have friends and family that might be addicted, and we also have friends and family that might be on pain medicines?
You're absolutely right. The opiate pandemic didn't take a break while the pandemic was front of mind for our communities. In fact, it's probably worse now than it has ever been. More than 100,000 Americans last year died from a drug overdose. So having the skills to both recognize an opiate overdose and intervene to save someone with the use of a reversal agent like Narcan, or if it's a family member, providing artificial ventilation like mouth-to-mouth ventilation is life-saving and is so crucial to our response to these very, very threatening problems. Many times, these people who are overdosing don't know that there's a powerful drug like fentanyl in whatever they're ingesting. And that is such a powerful drug that causes respiratory depression. People often overdose and are at very high risk for dying, even with the first exposure. So our public safety interventions with recognizing the signs and symptoms of a drug overdose, activating EMS, and providing life-saving care, whether that's using Narcan to try to reverse the effects of the opiates, which cause severe respiratory depression. It stops your breathing and leads to low oxygen levels in the body, which can have very serious consequences. Or even providing artificial ventilation in the interim until professional first responders can get there is a life-saving intervention. Those are things that we want our bystander rescue care providers to be able to do.
You know, Dr. Boats, we were really surprised when we found out that 1 in 10 of our schools, our 100,000 public schools and the other schools that we have across the country, 1 in 10 this year will have someone who has an anaphylactic event. And the second thing that is really shocking is that adults, 1 in 20 adults at some point in their life will have an anaphylactic event. And the third was that 40% of people will have one without any knowledge that they might have allergies. Now that kids are going back to school and people are back to outside activities and that kind of thing, how important is it that we all know how to use an EpiPen?
I think it's crucial that our bystander providers are able to recognize the signs and symptoms of a severe allergic reaction, something we call anaphylaxis, and treat it appropriately if they have the resources at hand. An epinephrine auto-injector or an EpiPen is life-saving in those circumstances because of the overwhelming inflammatory response that can happen with this severe allergic reaction to insect bites, medications, or foods. And so our ability to both recognize and manage those problems until professional first responders can get there is a life-saving intervention.
Dr. Boats, the one area that you and I really have fun teaching is the Stop the Bleed program that was launched as kind of a collaborative effort after the Sandy Hook active shooter event and the other events. And it's been really fun teaching people the control of severe bleeding. And we've incorporated it into our MedTech program and our rescue stations that we're placing at beaches and schools and churches. How important is it for everybody to know how to stop severe bleeding?
Again, the ability to recognize life-threatening bleeding and to do interventions to stop that bleeding is so important in reducing the risk of severe harm or even death to people with an injury that causes excessive blood loss. Stop the Bleed is a program that teaches bystanders without medical knowledge how to recognize and manage severe hemorrhage or bleeding until first responders can get there. So that's the use of direct pressure over a bleeding wound, using a tourniquet on the extremities, or packing a wound and providing pressure over a bleeding wound if it's not in the extremities is a crucial intervention. We know from the military that that's life-saving. On the battlefield, they've used that now for years and have shown tremendous improvement in survival from penetrating wounds. It translates well into our communities, and the ability to have bystanders provide that simple intervention until professional responders can get there is so important to reduce the likelihood of a bad outcome like severe injury or death after those events is crucial.
Thank you, Dr. Boats. And, you know, we started this coronavirus community of practice because one of our 8 causes of death and harm were infections, and we've have not really focused as much attention on how to take care of infections that our scouts, our athletes, or our campers might get with the pathogens that are now lurking in the soil and in our community. And so although we are going to focus tremendously through our program for tackling the coronavirus variants, vaccines, masks, what about treating infections and lacerations, and why that's so important now compared to maybe what it was like when you and I were kids?
Well, you're right. That's a very important focus for our bystander care. I practice in an intensive care unit, and I deal with the consequences of sepsis and septic shock on a daily basis. The ability to recognize a serious infection and treat it aggressively before it gets to the point of severe sepsis or septic shock is, again, a life changer. So the ability to try to prevent the body from having a severe infection and the reaction to that severe infection is so important. Early recognition and early intervention with cleaning a wound and using appropriate antibiotics or antimicrobial medications that are appropriate for the potential infection is so important. But really recognizing that someone has that sort of wound that's at risk for an infection and keeping it clean and seeking medical attention as soon as possible are good interventions for a bystander rescuer to initiate.
Fantastic. Dr. Boats, we learned in our development of the MedTech program about the enormous number of transportation accidents that harm children every year, every week, more than 100 a week, 4 fatalities. Over 60% of the drivers are a parent or a friend. Now that we are back and much more active with school and athletic activities, and we have kids that haven't been around cars in parking lots, and we have kids like my son who's now 16 and learning to drive, frequently we don't recognize how frequent, terribly traumatic, and even fatal events can occur without prevention of transportation accidents. Your thoughts?
Well, you're absolutely right. We know from the data that's coming out now, as we have emerged from the pandemic shutdown, and more people are driving, and more people are driving in a crazy fashion. The number of injuries and fatalities from traffic-related incidents is on the rise. And so it's surprising that there are so many young kids who are seriously injured or killed with transportation events that are so preventable. And so having good practices, especially in places of transition, like where kids get in and out of vehicles, is so important.
You know, being a pilot and you being an expert in simulation, we rely on checklists. And the one checklist that my son and I use before we drive in the morning as he's practicing driving and going to surf events and practicing is before you turn the key, make sure that you can see, is our very first checklist item. And it came from actually the work that we've done with you on these transportation accidents. So we were just really unaware of how traumatic that they could be and how frequent they are. The last topic is bullying, and it really overlaps with the opioid overdose issue and understanding CPR. And we know that that bullying can be a very important issue. We know in our healthcare system that we have an enormous amount of workplace violence, but we also have an enormous number of young women, young teenager females that are coming in who are suicidal. And we understand that for every attempt or for every successful suicide, there are 25 attempts, and many of them have to do with opioids. So how important is it to prevent bullying?
Well, bullying is a very important topic to address in our communities. It's along the spectrum of violence that includes workplace violence and domestic violence and random acts of violence that are occurring in our communities in increasing numbers. It's a behavior that is so damaging to our young children, especially school-age children, who are so affected by the external perceptions of how people think of them. And so the effect of bullying on someone's self-perception and identification is a very injurious effect when bullying takes place. And so we have to do what we can to try to both recognize and manage the events where bullying take place and try to stop the cycle of psychological and physical damage that it does.
Well, thank you, Dr. Boats, and thank you for your inspiration, your leadership, and being really our clinical leader in the MedTech program. It's been awesome working with you.
Thank you very much.
So as we round out our discussion, we put together in 2021 a family lifeguard program. This was with Mr. David Besch, who's an award-winning teacher, and a group of young people that actually started as scouts and have now grown up to be teenagers to develop a checklist program that can be used by families that would allow them to be able to protect the family during an event. And they address the safe practices of social distancing, use of masks, hand washing, and disinfection. We actually address the issue of how ventilation could be added with that. And so as we close this program and we talk about the things that are slipping through our safety net, we have to go back to some of the fundamentals as we think about COVID. Social distancing, masking, ventilation, and testing are all elements that are absolutely critical. We can't forget them. We need to be ready and prepared as we head down the pipe. And we start to look at what will go on. We're so grateful to have the group of speakers that we've had. Those of you that have watched the long form, it will be broken up into a shorter form so that each section will be able to be viewed separately. And we're very grateful to have this group of great speakers, both pre-recorded and recorded. So God bless you. And we thank you for attending this webinar. And we look forward to seeing you next month.